on this computer so I can make this available to you. And if you want to record it as well, let me give you
That'd
permission to do that as well if you need to on your end. Here we go.
be great. Awesome. Just because my husband is helping me through all of this, and so he would love to watch.
Sure.
So
Absolutely. And there's a lot that I have discovered. So I tell you what, Meg, after reviewing your case and I read your story, I just it was written all over it. And I want to know your reaction to your symptoms, how they evolved, where you've been. All of that was like undeniable. So
okay,
tell me your story real quick, because I know it all, but I just want to hear it in one place. Go ahead.
sure. Um, so let's see. I starting in about high school, I noticed that I was just a little bit more tired than my peers, than other people I swam with. And I always contributed to, oh, I have to get up early for swimming and I work hard in school, so I'm just tired. And then it got progressively worse in college. I continued swimming through college. I still, worked hard in school, but I found that even if I got like 10 hours of sleep at night, the next day I would crave like a 3 hour nap, like a full, almost like half a night's sleep, essentially. And even though it was college, I still really prioritized getting sleep and those kind of things. And so that's when my psychiatrist put me on Adderall, kind of as just a band-aid to stay awake, because that's how debilitating it was. And then
And that's
since
college, right? So you started going on ADHD medications because you need to stay focused, but you can. Lack of sleep is really catching up with you. You have one foot on the gas, one foot on the brake.
Exactly. And so the Adderall, makes me anxious. It does a bunch of other things that I don't want to be on Adderall forever. That's for sure. And then after college, I started teaching, and I always kind of attributed it was always hard for me to tell if the fatigue was because I'm in a demanding job that just takes a lot of energy and I don't sleep well, or if it was something else. And then that's when my psychiatrist referred me to Dr. Danny, because my psychiatrist, he's more of like a functional medicine. He has that kind of lens. So he's testing a bunch of my hormones, and my testosterone was extremely low. My pregnenolone was extremely low. So he's like, go to this functional med clinic to see about hormone replacement therapy, because my psychiatrist said that was out of his realm. So when I went to see Dr. Danny, that's how I got in touch with you, but also just trying to get my body back to a baseline where all of those things, all the hormones and whatnot are normal, to see if that would help with the fatigue and those kind of things.
Mhm. Now, that just like, it baffles me every time I hear this. Younger patients that constantly come to me with the exact same things that you're saying, and the number one factor is fatigue. They don't have quite the metrics of disease they would get
Right.
treatment for, but fatigue is the number one. So currently, if you were to wish one thing, I mean, I read through your memoir and I keep saying that I just want to be able to get through life like a 27-year-old, 28-year-old. Is that
Right.
and get a good
That's
night's sleep and wake up and feel like I can conquer the world as well? You should. So I'm really excited to be a part of this journey with you, as I call it, the healing journey. I don't believe in treatments. I believe that you come in and we discover things together, and we become a partner in your health, which is why I love working with functional medicine. I love working with Dr. Danny because he gets it.
yeah.
Medical doctors, unfortunately, they usually don't look beyond the metrics that are given. So I'm going to go ahead, and this might start, yep, it will start subtitles, have to stop that. Good. So if at any point you want me to stop and explain anything in details or further, please do. Okay. I have the next hour with you, and I'm going to make sure that you get the most of it.
Well,
So
thank you.
absolutely, this is the time that I don't take lightly. Every time that just I am a Christian and I believe in God, and I feel like God is putting people in my hand to take care of, and you're just another, one of the angels that I need to just take care of.
Oh, that's awesome.
Do you have children of your own, like by any chance yet?
No, I just got married last summer.
Congratulations.
Definitely, thank you. Definitely in the next few years, but we were both, my husband and I were like, we can't even think about that until I'm feeling well enough.
Absolutely. Because once we get you, we get your children as well. the things that you should have had preventions to, we can prevent your kids from going through. So with
Sure.
that said, you're a high school teacher, 28 years old at the time. And this is what brought you to me, chronic fatigue of 7+ years that you remember. And now you were led to do a sleep test, that sleep diagnosis came from there, which we're going to go over, but it was not something that you sought care for in the beginning. So what I put in here, we're going to come back full circle to. What I'm seeing in here is, hold on just a second, I want to make sure it's not a sensitive text coming to me now, it's not. That your symptoms started roughly about 12 years ago when you were in a swim team, you were active in your life. At 12, 13, you started having symptoms and made a note in here. That's about the time that you got braces, correct?
Yes.
Do you
Yes.
feel like there's a correlation between the two? I'm not trying to persuade you one way or another, but I keep looking and reading and I'm like, this is so obvious. It might as well be a nail in your forehead because everything you reported started at the time you had the braces installed. So physically, you're anything that's below 5 in that borderline, I'm going to highlight, and I have highlights over it.
Sure.
Physical. You're a young 28-year-old female, and that number should not be low. So that's an important one to me. And an ability to handle daily work stress, social life, and sleep quality and duration and hormonal balance, they all go together. What those blue highlights here are pointing to is that you have your nervous system, autonomic nervous system, that basically controls everything in the background, which is fight or flight or rest and digest, is always dialed into low-grade sympathetic, #overwhelmed. Your body,
Yeah.
your system is overwhelmed. I mean, you know that, I don't need to tell you, especially when we see hormonal imbalance in a female, because we are, as females, our hormones and cycles during reproductive years is super sensitive to everything that comes from the environment, legitimate, because your brain is concerned about potentially getting pregnant and feeding another human being. So if your system, for whatever reason, is in an overwhelmed stage or sympathetic, your body will not allow you to host a baby because you're not safe. When you're
Right.
you have fire in a house, it's just the brain knows best.
Right.
Where is that coming from? The quality of a sleep is poor. Is this a sleep transition issue? Is it truly a breathing issue that bled into them? We're going to find a few things. Now, before I go further, I'm going to be a little bit detailed about the sleep. Do you feel like you go to sleep at a certain time? And I can go to sleep fast, but I wake up at the same time every night or most times, and I'm unable to go back to sleep. Do you relate to that?
I would say, yeah, I'm always fast to fall asleep. And it's around the same time every night. And I do every night, usually like anywhere from midnight to 3 a.m. I wake up.
Yep.
And I usually can fall back asleep unless something is really stressing me out. But for the most part, I can fall back asleep.
Okay. And do you feel like you clench and grind your teeth when you wake up in the morning? You feel like you have sore facial muscles, things like that?
My grinding is terrible. And ever since I started living with my husband and sleeping in the same bed, that's when I knew it was really bad. Because he wakes up just from the noise of it. And I find myself even grinding during the day.
No, I mean, I totally relate to that. The reason why I'm asking that question is because sleep quality could be affected by breathing, because obviously there's no bigger threat to our system than not being able to breathe. So that can affect it, but also sleep cycle, sleep maintenance, sleep transition. So do you classify yourself as a light sleeper or a deep sleeper? I feel like I can never go into deep sleep. I feel like I'm aware of my surrounding. If something happens, boom, I'm awake.
I would say I always thought I was a deep sleeper. And I would like the first half of my sleep, I would say, is really deep. And then I'm more likely to wake up if I hear something in the earlier hours of the morning.
Got it. So that's the REM stage of sleep. And do you think you ever dream, or did you ever dream? Are you
Yeah, my dreams are usually quite vivid, and sometimes I at least feel like they wake me up. So I've intense dreams.
Well, most likely you're what we call REM dominant, which you're familiar with. The deep stage of sleep, light stage of sleep. Deep stage is delta, complete dissociation of the brain and the body. That's the beginning of the night. The REM stage of sleep, rapid eye movement, is when you have theta waves. Your brain waves are closer to awake in alpha, and then you go into beta and wake up. Why is that important? Why is a dentist bringing that up? Because when you have sleep maintenance issue, that's a sleep transition. Your neurotransmitters are off. Hence why you're seeing Dr. Daniel, and you have hormonal balance here. One of the most important ones, cortisol. So I don't know if he does Dutch testing. Have you had Dutch test? Because that's one of the things that Dutch complete specialty will show is that cortisol. And that's one of the things I will have for him since you're having a visit with him today. Where's your cortisol? What is he going to do? What testing is he do to analyze that parameter? Because the cortisol overload usually is connected to the stressors of the sympathetic. Again, the breathing can affect it as much as other factors. I don't want to be just short-sighted and saying for sure it's just a breathing problem, because a lot of times there's other hidden problems that can affect the cortisol. I'm putting that on my short list. What else could be contributing to it? Hardware and software both can contribute to the cortisol and sympathetic overdrive. What are the software issues? Unresolved childhood trauma. And trust me, I was having more of that issue than I had breathing disorder. I didn't have any breathing issue. It was more of that causing my cortisol, and addressing that, I'm in a deep sleep. That's what pretty much I want to make sure we put it on the list. Sleep transition, breathing disorder, hardware can cause a software problem. Just know that that's a whole another separate issue. So like I said, they all look like, this is what I say when I put the story together. It looks like a duck. It quacks like a duck. It walks like a duck. You look like someone who cannot breathe. Let's find out why. So the one thing that really caught my attention, I go back and forth, that's why I have highlights all over this, is most things that started right around the time you were about a 5th grade, early high school years. And even those sleep long hours, you're feeling exhausted. And the fact that you're clenching and grinding is a testament that this is most likely an airway resistance issue, because a lot of times our clenching is an attempt to get our system moving. Getting oxygen in, the mechanism is really not known, but we know they're 100% correlated. And the skin breakdown and all thyroid issues are connected to this, because again, if you're establishing your body's running on high cortisol, because cortisol kind of goes down with melatonin, and then during the night it should be down, so is your urination, and then in the morning cortisol goes up so we can get up going with our life. Now, if your cortisol is up at 3 in the morning, the level that should be at 9 in the morning, Houston, we got a problem. But why? More important is the why.
Right.
Darling, I just my heart just broke here. You're a normal human. I'm there with you. Who does? Like, you're 28 years old. You should be conquering the world right now. And my prayer is that we're going to get you there, and we're going to get you there fast. And having energy to fulfill life and have multiple babies, have as many as you can before you're my age. And life is spontaneity. Yes, absolutely. Get in the gym, doing all the cool stuff. Yes, but we need a couple of team members I'm going to have to pull into this. And hopefully we can get this done. So thank you for telling me about your birth history. Normal delivery doesn't mean normal, because sometimes there's traumas involved with it, but you would never know, because your mom was in labor, you were still like, you would never know that. But the fact that you were breastfed for a short period of time tells me that potentially you have an issue with the tongue tightness. I'm not sure if you know. Did you have any issues with speech growing up? Did you have any speech with like S, R's, things like that? Did you have any of those?
Yeah, when I was, let's see, probably up until right before kindergarten, I had trouble with my R's. But my mom always said, well, if we get to school and the speech is still there, then we'll see a speech language pathologist. But then it just kind of went away on its own.
So you're aware of the speech issues, and when you're reporting speech problems, that is 100% indication of the restriction of the tongue. And we're going to take a look at that today as well, because both myself and my assistant Liliana are certified in oral myofascial therapy. So we are really good at finding out, okay, what's going on with your tongue, and we need to work with someone to address the tongue posture, because until your tongue is trained to rest the roof of your mouth, you can't nasal breathe. And if you're not using your tongue, your body is going to be completely having all of the symptoms you reported. You're looking very much like the average patient comes to us, and I'm glad to report you're in a perfect place, because this is what we do all day long. You're not seeing anything else. I know you might feel like, oh my gosh, I've got all these million symptoms, but they all boil down to one thing. And if we get that one thing addressed, your body goes back into functioning. Hopefully, not over promising, but I've seen it over and over and over. Then you said again, the things that you're reporting is the assurance that I have. The fact that you had to have ear tubes put in, because what you have is a contortion in your skull where your ear canals are, the bones that carry your ear canals are correlated to your mouth, which all is something you carried with you. The tongue tightness is completely directed to that, because if your tongue doesn't get to the roof of your mouth, your ears cannot clear. So the fact that you had all of those conditions with ear infection and pneumonia and asthma, they all say one thing: dysfunctional breathing, a mouth breather, a chronic mouth breather. And when you're dysfunctionally breathing, you have all that laundry list of symptoms growing up. The fact that you needed braces is because your mouth didn't grow because your tongue wasn't functioning. Now let's go where braces might have something to do with it. The medications that you reported you're taking for hormonal balance and the chronic fatigue, the anxiety, menurias, all of this, especially endometriosis, has been connected to majority of patients that I see for exact same thing. I'm hoping that you haven't had any surgeries or anything like that, right? You're just
No.
looking into medication, so thank goodness. These are the list of meds. Omeprazole, by the way, you reported GERD, gastrointestinal, and I'm guessing this has been, like, again, a long-standing history. When you have a narrow airway and you're trying to breathe through in the night, when you have an obstruction, when your tongue kind of collapses into your airway, you have this negative pressure created just trying to open that airway, which is conducive of clenching. In that attempt, that negative pressure against the positive pressure create a negative suction. So pulls the acidic stomach, and it kind of causes irritation in your throat, which in the morning you feel like, I feel like my mouth feels funny or my throat feels funny. I have to just clear it. Does that relate? Mucus buildup?
Yep.
Gastrointestinal GERD, long-standing history with GERD and acid reflux is 100% has been linked to obstructive sleep apnea and upper airway resistance syndrome. I keep saying OSA, but really OSA is like diabetes. You know, you could have diabetes if you had long-standing history with insulin sensitivity. So these are all correlated. So far, I'm not seeing anything that is outside of, I would say, this doesn't fit right. Let's talk about your headaches. The fact that you have reported sinus pressure, light sensitivity, stress, and Liliana, my assistant, she had all of the symptoms 3 years ago, and they're all cleared. One in particular, she can tell you after we did the tongue release, completely address that. So the aching sharp pain is right around here. Is that correct, Meg? Right around?
Yes.
Okay. Now, if you were to have sharp shooting pain, is it bilateral or is it just one side?
Oh, I would say when it's sharp shooting pain, it's usually just one side.
Okay.
I like frequently get the ram's horn headaches. And those are also usually one side, but it starts as one side and then it moves to both.
Now, if you get those type of headaches, would you say it's starting in the morning, or is it more of a later in the day kind of a pain?
Definitely later in the day.
Got it. Because what happens is a lot of those symptoms, your short shooting pain, comes from back of the skull, where there's a lot of neurological tissue between your skull and your spine, the first vertebra. If you see chiropractors, you're familiar with atlas. And the fact is, if the position of the, not if in your case, is position of the spine and your skull is off, all that neurological tissue is getting impinged. And they do send pain messages to the brain. If you wake up with it or you have it later in the day, it's all related to the posture. It doesn't surprise me. The aching pain right by the side of the head is coming from muscles that are compromising your head in a posture, not just ergonomics, because you're a teacher, you're indoors, and you're probably sitting around with the kids on your computer and cell phones. That can exacerbate it. But the first response to our posture is where we can breathe first. So if you have a narrow airway and you adapt with it by your posture, that constantly catch up with you throughout the day, because muscles that hold your head like a bowling ball. Think about your head like a bowling ball. If you hold a bowling ball right here all day, okay, first 10 minutes maybe not a problem, but 2 hours later it will ache, right? You tell me my shoulder kind of hurts, doc, and my all these muscles will be like, yeah, because you're holding this bowling ball. Your head is kind of like the same thing on top of your spine, chest caved in, all that. So what I'm seeing here is you have sinus pressure, headache, can't breathe. I already know you're a mouth breather. Light sensitivity, all of that is overactivity of neurological tissues. Behind the eyes pressure is that lymphatic is not draining. The fluids around the brain is not moving. All of them are pointing to that same thing. I'm not seeing a reason to think, could this be a neurological issue? Let's clear the most obvious first. If it looks like a duck and quacks like a duck, not looking for horses. You're
Right.
looking like someone who has a postural distortion, malalignment in your skull bones, jaw and facial bones. Your face did not grow properly, hence why you needed braces, and you're struggling to breathe. Everything I'm seeing here, which after we take our CT scan and we do the analysis, we'll find out more, and we'll find out where the how many professionals we need to work with. Usually a
Sure.
chiropractor will and me are going to be sufficient, along with a mind functional therapist, just to get you to the proper function. Does that all make sense so far? I mean,
Yes.
within 15 minutes, if I'm not able to get the patient to see their big picture, I have not, known you enough or studied enough. Like, all it is are written all over your face once I start kind of tackling them. Seasonality, again, you're a mouth breather, that's go along with that. And then the fact that you needed palate expanders, that means you had a narrow palate, but usually they relapse because what they don't focus on is the tongue. And they still don't, but more so back then. And they did not extract, they did extract teeth on you. Now, were they baby teeth they extracted or permanent teeth extraction?
I'm 99% sure they were all baby teeth.
Okay, so you have at least 28 teeth in your mouth, because usually they take out the third molars too, wisdom teeth. You had your wisdom teeth removed.
Yeah, I just had those removed in 2021.
Okay.
Yeah. Mhm.
So okay, were they impacted or in your mouth?
Oh gosh. I think they were impacted.
Okay. Because if they were impacted, that means you're at least, the width of a molar, third molar is just about a one finger. At least your one finger, your face has not. A centimeter is your face is back. Because a normally grown face should be accommodate 32 teeth. So if your jaws did not grow to accommodate them, you're at least a centimeter behind the arc of your growth. And that centimeter you borrow from your airway. Make sense? But you don't have
Yes. Okay.
it. And that's amount of forward head posture you assume, right? And then
Right.
yeah, the whole host of things. So you can get to sleep. We already talked about your sleep. Your sleep hygiene is not too bad, but we all have guilty as charged with the blue lights and
Right.
transition to sleep. And electricity is unfortunately the problem of this generation. It can be better, but that's not the main contributor of your headaches. I just want to be clear on that. Sleep transition, maybe, but that's not a contribution of to this. Not feeling rested, that is something that we definitely would need to consider. You're not seeing chiropractor or physical therapist, never been brought up. I'm guessing you never had any traumatic, anything that hurts. But if I go down the list, I'm asking you, do you think that you have like neck pain, back pain, low back pain, pain in your like bottom of your foot, tingling? Do you have any symptoms you want to share with me here, Meg?
Yeah, I would say lower back pain. I mean, I know part of the reason my posture is so bad right now is I'm sitting in this office and there's like this couch is a mess. But my husband's a doctor of physical therapy,
Mhm.
and he, I'll say like, oh, Andrew, my lower back hurts. I must have, worked too hard at the gym. And he's like, well, look at how you're sitting. Look at how you're standing. Like lower back, the tingling in the fingertips I get, especially in my ring finger and my pinky.
Mhm.
Um, and I would say I do have like a lot of random, well, they're probably not random, but random pains throughout the day that are just like these muscle
Where?
pains. That's definitely my neck.
Mhm.
Honestly, my whole back.
Mhm.
Um, my neck and back are the most
Okay.
for sure.
All those nerves that you just told me, like the ring finger, there's nerves called ulnar and radial, and I'm sure your husband is going to listen to this. So physical therapists, I work with physical therapists a lot, and this is the thing that we kind of like work together, is that nerve that goes through here, goes all the way through your arms and enters into your skull in between your cervical number 1 to 3-ish. And that's all connected. That's where your jaw is hinging. So if you have underdevelopment and everything is contortion and impinged, that will affect your posture. Your head being in a forward posture will affect impingement on those nerves, which is all those symptoms you're explaining. Most people, when they're in your age, they don't go see a chiropractor. They feel like, oh, maybe it's just ergonomics, because when you're 20 some years old, you're immortal. until you hit my age, now you're starting to feel like, nope, nope, gravity's real, and I don't know how to deal with it. Then you start seeing chiropractors, and they tell you that you have upper cervical like degenerations and things have been, but it's been like that from probably when you were 12 years old, much younger, probably. So thank you for sharing all that with me. This is really helpful because, again, everything that we're just seeing so far, from stress to GERD to autonomic, everything is just telling me the same thing. The story is high alert sympathetic nervous system on, or probably overwhelmed state. We don't know which one, but that's basically when your sympathetic is on, your hormone system for digestion, reproduction is down, vagal tone. This could be induced from a biochemical ground, which you're seeing Dr. Danny for, or it could be starting from a physical standpoint, your structure in your head, structure in your spine and pelvis, and then they kind of feed into each other. So I address the physical orthopedic ends with my PTs and chiropractors and my fascial therapist, and he does everything else that has to do with biochemical. If we
Sure.
keep both of these two well, and there's nothing else, mental, psycho, emotional, we should be able to get you home. This is why I ask about your hobbies, what do you do for stress management otherwise, and if you have like the mental spirituality aspect of things, because a lot of people, they do carry trauma. They see a lot of people that there's that aspect of life they carry with them, which can bleed into all things possible. And I just like to lightly touch on it because we can treat the most obvious, but we know as humans, we have 3 dimensions to our health: physical, chemical, mental, emotional. So we're going to focus on the 2 obvious, me and Dr. Danny, and leave the last for, just like I said, that is something that is not in my area. I just want to bring it up, if that's okay
Sure.
with you.
Yeah,
So,
definitely.
also, one thing I want to ask is, especially with females that are running on cortisol, do you feel like if I go for a run or weightlifting, if you go to the gym and get a good, weightlifting session, do you feel like you sleep better? Does that affect your sleep, or you feel like it makes me more fatigued? Because you said if I do that for 2 days, I can, but does it ever affect your sleep if you do exercise?
Um, I kind of want to say that sometimes when I exercise, I don't sleep as well,
Okay.
which is I feel like the opposite of most people. You exercise and then you're more likely to sleep. But I probably would have to keep better track of it.
Mhm.
And I'm just, yeah, I would say generally the more I exercise, the my quality of sleep is reduced at least a little bit.
Which, like I said, most but of my patients, that they do have upper airway resistance syndrome, and they have a high functioning cortisol-driven sympathetic. They do get endorphin, and somehow they kind of reset, and that's a thyroid issue, by the way. They overcompromise with it, so they get a bad quality state. If you don't, that just tells me that you are getting more into a catabolic state than an animal. Like, this might have something deeper to do with it. And I'm so thrilled you're working with Dr. Danny. If you came to me for breathing disorder, let's say you had a TMJ issue, or I would be sending you to someone like him because of that. Because fatigue is a multidimensional thing. It's like we all have to look at it from all 3 of those triangles I told you: mental, physical, chemical. And this is fascinating to me, that when I see a patient that's suffering this much from, if they're not benefiting from exercise, I would love to work with him and see where that is, what other biomarkers he used, because there is homocysteine, there is methylation factors, there is what genetically, what food your body can process, mineral content, all of that stuff comes into account. Because high cortisol, you're stealing minerals from your ligaments and joints, and just to kind of keep yourself in a state of function, right? What do we need to give your body to provide it what it's lacking? Is it minerals? Is it vitamin B? Is it methylation support? Gosh, a whole host of things. I learned so much from this functional medicine. I just came back from a longevity conference in Dallas, and this whole entire conference was all about functional health. So there's a lot more to be unpacked over there.
Sure.
So the yeses here, we already talked about them: snore, fatigue, mouth breathing, abnormal posture, muscle spasm, cervical pain, and jaw pain, all my area. Welcome to my
Yep.
world. So look at your face. If you want to stop me at any moment here, Meg, just ask the question, we'll stop, okay?
Okay.
So the 2 things that kind of, I keep going over the face and the body, and just like a domino effect. So think about a domino. You can just put a flicker in the very small, tiny step of a domino, and you can move a giant 100-pound, member of the domino effect at the very end fall by just one flicker. So when I'm looking at the features in your face, think about the feature in your face as what could be representing and triggered by everything down below, including your pelvis and spine and everything else. So the lines I would put here, ideally, our eyes, our ears, mouth, nose, just our head structure, neck, pelvis, shoulders should be all level, 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 level with gravity. Why? So we are symmetrically moving through space and not compromising. Although our body right here for your husband is not symmetrical. So our torso is not symmetrical, but the rest of our system should be propelling as we go through space. While looking here is which side of your face is underdeveloped, which side is overdeveloped, which one you're using the most. So that's why I have these lines here. Does that make sense?
I'm just like laughing internally because my sister just came to visit a couple weeks ago, and we had taken this picture and we both looked at each other and said, why are our faces not symmetrical? Like both she and I have, like, I've seen this in other photos where I'm like, something is kind of off about my face. And I'm not saying it like from a beauty
Is your
standpoint.
sister the same way?
My sister is the same way,
You
yes.
can blame your mom. You know why? I'm not saying it to be funny. Your mitochondria comes from your mom, but so does the shape of your skull. You know where your skull was formed? In your mom's pelvis.
Oh,
Mom's head is misformed and carried over a pelvis that's not even. Your head formed there. You came out of the womb this way. This is why I keep saying it's not just at the time that you needed braces. It started way before doing birth. That's why I ask about birth trauma, birth effect. How are you positioned? Was it a fast delivery? Was it a, suction delivery, that kind of stuff? Because position in the womb, we call it fetal attitude, has a lot to do with this. This is how we know. Coming out of the womb, and now when you breathe, as we breathe, our bodies get formed. Like you pump a body ball that comes in, kind of like folded up. In a male Amazon sensitive comes with a pump, right? The pump is diaphragm. So as we go through life, our faces form as we breathe with our diaphragm. Now, if your face and your skull is twisted in the womb and during delivery, just for starters, no trauma other than just the birth. As you breathe, one side gets developed and the other one doesn't. Now, if your tongue is also, which is attached to them, is not symmetrical and damaged through that process, your tongue is not doing you a favor by shaping that face. You see that now? Because your tongue is equivalent of your diaphragm. If your tongue is not properly functioning, you don't have a properly functioning diaphragm, that's what happens. Yeah, that's great that you noticed it, because yes, asymmetrical faces are developed from an asymmetrical body, and they lead to an asymmetrical body. So the way we analyze it is the round eye. As you can tell, one eye is lower and narrower, one is wider, more dominant, and that's your right side. So right side eye is larger, but your right side face is squished, if you could just bear with me here. And it looks to me like you have, the eye is down here, ear is down here, and also the neck. I outlined the neck. So it's like your neck is going to the left, but lower jaw. Now I'm going to go ahead and stop the share so I can just take a look at your face. This is where, and my assistant Liliana is here, call math is not mathing. And that's a language your students probably use.
Yeah.
Right? And math ain't mathing. Because mandible, your lower jaw and neck should be opposite of each other. In your case, it's not. Your airway is twisted more on one side than the other. You're not able to clear everything out of the right side. Your mandible should not be on the right side, left side. It should be on the other side. Nothing here. And I'm already thinking, the first line of treatment I would with you is I want to put a unilateral bite block system in your mouth, just on lower jaw, just at night, till we work with a chiropractor and align your pelvis. I want to see how you respond to that. I've seen amazing things. Amazing. When I locate the mandible where it should be, the body goes, it's almost like if your sink is overflowing and that's like kinked and stuck in the middle. If I remove that, whatever drainage problem is, the whole thing. And then we can go back and shut down the faucet that's dripping and then mop the floors. And you're like, the whole time was the problem, right? That's what I'm saying here. It's like there's a kink in here in the system. Head is shifted to the left, mandible is also to the left. Mathing, we were talked about that. Left side eye, low maxilla, which is your upper jaw. And I have a hard time deciding your ear position here because it wasn't quite clear, but to me it's like your lower left is hanging out as well. My guess is what happened with orthodontists, they lined up your midlines, although your skull was not. So they locked you in where your body did not want to be. Your mandible doesn't want to be on the left, but since your maxilla, the top and the bottom kind of come together like this. Okay. So if your upper jaw is here, because your skull is shifted, the lower jaw is here. They say, well, let's just put the midlines here. But the mandible is like, I'm not happy there. I don't want to be there. Maybe. I'm not sure. I need more records for that matter. But this to me tells me that there's a twist between your neck and your shoulders for that reason. Does that make sense?
Yeah, definitely.
So think about your head and your torso and your pelvis as three triangles that need to be supported on top of each other, and your spine is in the middle of that, which is why a lot of people, they think they have scoliosis. They really have a twisted skull, and body has to support an asymmetrical skull, and then there's twist in between the two end points. So now you have twist in the spine for that reason. It looks to me like you have it, and I put some terminologies here, but I'm not confirm it. I don't expect you to know what that means. If your eyes and your jaw are in like this, if your eye is higher on the same side as your jaw is shifted, that's a torsion. You do not carry a classic torsion. You're a side bend. That means your skull is twisted on the left side, but you're carrying a feature that is consistent with right torsion. It does not make sense until I see you in person, which is why I'd love to see you. If we could arrange, because then I can do a testing and find out what's going on.
Definitely. And I also think, I know you said the image doesn't show. I definitely know, I don't know if this is what you meant, but one of my ears is slightly lower because when I wear sunglasses, they tilt.
No, for sure. No, that is. And I have to, you see that error that I have? And I pointed
Yeah, okay, yeah.
So, yeah. And do you have tinnitus and ringing in your ears? You feel like, and when I open, I have a pop or click and noises. Like I can constantly hear this noise, background noise.
I wouldn't say it's definitely not constant like tinnitus is, but I definitely have more. I hear a lot of things in my ear throughout the day, depending on how my jaw moves.
Yep, for sure. And the more you clench, the more, because here's your ear canal, the same bone that carries your jaw joint, the ball and socket is the same exact neighborhood to your ear canal. So if your jaw position is shifted, as we can see, because your ear is, your jaw is shifted, it will affect the ear canal function. All balance center too. Vertigo is the #1 symptom that comes with twisted, skull. I keep calling it twisted skull. This is really what it is. So as you can tell now, your head is shifted to the left. Now we already saw that, but now you can see it. When you put that head to that body, I had a hardest time deciding which side of your shoulder is lower and which side of your hip is higher. And I'll look at the back and the front. That's why I like all those angles. To me, both it is to confirm that your head is for sure shifted to the left. By the way, whoever took the pictures did a great job. Is it your husband who took it?
Yeah.
Okay, he's a physical therapist. I'm not surprised. Okay, so shoulders down here. If your hip is higher on that side, to me, again, the fact is you're basically grounded over here. Again, this is it's a PT language. You're grounded over here on the left. You get majority of your stability because I can see there's a space between your hand and your body, and you're most likely avoiding something on the right, I think. I'm seeing the contortion in your face under development. I can see the contortion in your body, but I need to put my hands on different points, do some kinesiology test, and I work with a very, very good chiropractor who actually does stabilize this very nice. Within 6 weeks, I've seen miracles with what he can do. And then we bring in the physical therapist to address the shoulders, and then I work on the skull portion.
Sure.
So what I do see is, remember I talked about the 3 triangles, the pelvis, shoulder, and head. There should be level, level, level. If they're not level, I want them to be parallel. So if one is higher, the other one needs to be lower, and the other one should be higher. You know what I'm saying? Like domino. That's how the spine couples. If your hip is higher on one side, shoulder should be down on head high. Let's see if you follow that pattern. You do that with your pelvis and your shoulder, but you don't do that with your shoulder and your ears. Your ears down on the same side as shoulders down. We already touched on it before we saw your posture. So that tells me there's something suspected in your upper cervical right here, that hump that we see right there, which is why I have the arrow. And you have this kyphosis going on, rounded shoulder, forward head posture. This is a very obtuse angle. All of that tells me airway issue, foot problem, airway, foot problem. Both of them kind of flat foot, plantar fasciitis, locked knee. That's why I have another arrow here. You have a locked knee. And then you see how you're shifting and avoiding in all 3 dimensions. Why?
Mhm.
To keep that airway untwisted, to make sure you can breathe. But when you're in here, when you're in a supine posture, you can't compromise like this. Gravity is going to put more pressure on the chest. You can't do this anymore. Now we have more of that resistive airway, negative pressure coming in, backward flow, I'm suffocating, my tongue falls into my airway. You see that vicious cycle? And you've been
Yeah.
dealing with this since the time you had the braces, or probably younger. But why do I think that the braces might have been a pivotal time in your journeys? Because you were able to compromise probably prior to, but after the braces went on and they locked you in, now you're locked into a position you can't get out of. Now, do you have wires behind your front teeth?
No. Mm-mm.
You wear retainers.
Not anymore. They're gone. I lost them.
Okay. Well, I'm not heartbroken over that. So let's take a look at I think I have, oops, okay, so, no, I have a better pic, there we go. This is a picture. I want to make sure to spend time, on pictures that have lines and markers on them. Now let's go back to your face. Eye is lower here, and then I'm looking at your upper jaw. Let's just go ahead and zoom in. So you see how your midline is going to the one side, shift to one side, and here's the midline. This is where I kind of had the hardest time seeing, because I don't know if this is the midline of your lower jaw, and I think it is. The lower jaw is shifted to the same side as the left side. Maxilla is sloping up here, and it looks to me like this is the narrower arch because I can see less teeth. This is all related, trust me. And when I'm looking at you, have you bring your teeth edge to edge, your lower jaw shifts itself to the right, which tells me, Meg, remember I said your lower jaw wants to be on the other side, potentially. Why is it hanging out on this side? This is a bit of a mismatch. It doesn't make sense to me. I need to know which jaw is causing you problem, because this system needs to come back to alignment, and your lower jaw needs to follow your neck first. Your neck and your lower jaw is confused as to where to land, because where your teeth are is not in agreement with where your neck wants your lower jaw to be, period. When your teeth come together, your body goes into sympathetic. Just separating your teeth alone, literally just separating your teeth alone and supporting you where it needs to be supported, your body would potentially go into, and I'm hoping I'm correct because this is written all over it. That's why I went back in the first page and I said orthodontics has a lot to do with this, because they tried their best to line up the midlines, but teeth are the arrows. They are not indicator of the system. Like the kids in your classroom, you control the kids in the classroom, right? The kids' behavior shows the quality of the classroom attendee. Your jaws and your body your body and skull hold the jaws, sufficing for breathing first, and then your teeth have to come into that position. We established you didn't have a normal functioning system before you had teeth. Now, when they're trying to get the teeth to align, this is the kind of thing I see all the time. So I'm excited to actually discover what we see together here. So let me just go ahead and move this out of the way. Actually, it's easier if I completely get out of the presentation mode. Here we go. So maxilla and the height, this is why I said it didn't make sense, because your maxilla is orienting to the right side. Your mandible is shifting to this side. It means you have a torsion, or sorry, side bending. Then I look at your actual presentation. It's mandible shifting to, mandible wants to be on the right. There's no consistency with what the pattern I saw. And I wrote in there ortho. That's the only explanation I could come up with. So let's look at you from here. This angle tells me everything I need to know. So I'm going to go ahead and zoom in on it again. You have a wider nostril on the right side. This is the right. Then the left side, you saw the asymmetry in your face, right? Carries through all the structures. And this side of your face is contortion. We already established you're narrower, underdeveloped on the right side. Your ears hanging down lower on the left, and your maxilla is narrower. So I made my findings over on this side, dental midline shift. I think the orthodontist shifted you. And this is where things are not coming together. Because, and by the way, when your teeth are lining you up in an unnatural position, that potentially could affect your neck. On your neck is the major highway that holds your airway. So let's say that your right side, which is the major highway of your breathing, most chiropractors and PTs know this, it's where the majority of our venous drainage happens. If that side is constricted, it's conducive of a lot of symptoms, especially in females because they have narrow anatomy to begin with. I think when they kind of pushed you into where you are supposed to be coming out of, that locked you in. Because ideally your neck should be to the right and mandible to the left, you would have had no problem. You would be smooth. You would be more smooth. Again, I'm not saying for sure. Having done this over and over and over, I see this and I kind of boiled it down to, why do we have this? How much of it is in the mouth? What can we do? So I went back and I looked at your cervical spine. At this point, you have no doubt that everything is shifting to the left. Okay, neck should be to the right, not to the left. Mandible to the left, I get it. Why is neck over there? Teeth. So I made my findings in here and I cannot wait to actually see you in person, see your CT scan and make my conclusive findings and then find out the way to approach the treatment. Now, are you right hand or left hand?
I'm right-handed.
Okay, well, that's at least good because you have a right eye dominance. And if you were left-handed, that would be just producing another torque here. Then I look at other things, like I said, your instability in your cervical, not instability is the wrong word. You have a hump in right here in the junction between your cervical spine and when you go into thoracic. And that is basically, that's a disconnect between the torso and the head. It's boiling down to the neck and how much the mandible has to do with it. Now, this arrow that I put in here, Meg, you know, that's point between your eyes. Your brain wants the chin to be in alignment with that. Your chin is a good while behind it. Remember I said you're at least a centimeter behind your potential? Right there it is. I don't have a CT. I don't know where you are, but I could tell you that you're a centimeter off and you're kind of going forward. Your ear is also forward just about as much because your ear should have been here. And guess who's paying to do for it? Your neck. So your airway is small and your lower jaw is back. You kind of shift your head forward, round the shoulders, cervical kind of go over here, and then you do this shift in your neck just so you can keep your eyes gauged, and that at the end of the day will basically task your nervous system so much, and all this pain and headaches you reported will be conduced by that. So I looked at your home sleep test, and this just is nonsense to me. Someone with, like, you have a label on you. You have a mild apnea, now they have a CPAP therapy. You don't have full blood. I mean, it's as ridiculous as saying you have a mild apnea as saying you're a little pregnant. There's no such a thing as a little pregnant. You have breathing disorder. You're not quite advanced in numbers yet. Your body is still fighting, hence why your sympathetic is on. Your numbers are in a very low grade, and I just looked in here and they even said it: awakening with gasp, dry mouth, excess daytime sleepiness, night sweats. All it is tells me I'm a mouth breather. But they didn't talk about that. So let's talk about that. What I see in your sleep test that is just a confirmation. I straight want to go into your sleep position. So far, I established that your one side of your body you're not using. Which side? Well, you most likely are sleeping on the side that doesn't work for you most of the time. I'm not saying all the time. And I had circles around it. You position yourself either on supine or left majority of the time. You don't sleep on the right side. So I think, right. So I think the right side, because that is the side that we, most of the time, that is our real, we have a larger diaphragm, we have more lung on the right side. We sleep on the side that is not, we're not able to compromise with gravity. I look at the sleep position, and then in the sleep test, I look at the stage of sleep. You see how, you know, you kind of go into, again, I don't know what, I'm not very familiar with this sleep test. What I look at is the stage transition. It doesn't tell me real time, minute to minute. Your oxygen doesn't quite drop too much, but you report it, you go down to 85%, I believe, 83. The lowest desaturation you go down to is 83. Average is about a 96. In Colorado, no one is 100. We're about a 98. I don't know how you are during the day, if you have a way of tracking your oxygen, tracking your heart rate variability. Some patients wear Oura rings, Whoop. They kind of monitor those metrics. So I have more access to where your oxygen is even during the day, because you're a mouth breather. It's not a single isolated problem. You're also mouth breathing during the day. I'm sitting here talking to Dr. Esmaili, I'm at 96%. Okay, well, you're here, even in Colorado, it should be at 98 or 99, right? Would that make your body fatigue? Absolutely, it will make you fatigue. Hypopnea numbers tell me that you have dysfunctional breathing and you have obstructive events up to 2 events on average. So again, the numbers are not, I highlighted the parts of the numbers that are important to me for seeing how they correlate to the story that your body has been telling me. You are mouth breather for sure. You have a resistive airway, and majority of your problems are dominant in your REM stage. The REM stage is where you're, and your deep stage of sleep, I don't know how much the quality of it is, because the stages here with this test doesn't show me. My sleep test will tell us where things are in real time. We probably can test you with that for a few nights, but we have a diagnosis. I mean, it's not uber important. It's just nice to have the same test in the beginning and the end, so we're not comparing apples and oranges. So from your sleep test, my derivative was the indices of your desaturations are so heavy when you are on your back. That means your tongue is causing you obstruct. That's a positional sleep. That's a resistive airway. And then the stages of sleep, the Epworth scale, which you answered, yes, I'm falling asleep throughout the day, low quality of sleep, all tells me I have a resistive airway, and I don't have the numbers big enough to show for it, because as far as medical assistance is concerned, I'm just a little pregnant. Let's treat this so that we can get you breathing, because the numbers here, the titles and the stickers don't mean much to me. I treat the symptoms, not the numbers. My goal is to get your tongue sufficiently properly positioned at the roof of your mouth, get your neck to occupy the proper position, get your mouth developed, arch development, which we can do in adults, to a proper position, get your lower and upper jaw out of your airway, get your pelvis aligned with your skull, and properly breathing. Those are the goals orthopedically we can hit. Not difficult if we have the proper diagnosis, which just the limited amount of information that I gathered, and by the way, you did a beautiful job providing. I think you're a very good candidate for my treatments, the orthopedic treatments that we do. So first step is Liliana's on the call. She's going to arrange, if I can see you at the Institute this Wednesday, if you can arrange for that. We take the entire records, and then I will have it compiled, and I will only charge you for reviewing your records, not taking them. So that would be a great help for you as well. And then I will just sit down here, review my findings, and then we see, okay, Meg, I think we can get you in this particular device for the time being. Let's see how your body responds. The next stage is definitely, I need to have you work with Dr. Greg Pearson. He's my sacrooccipital chiropractor. He's in Boulder. I don't know how easy it is for you to get there, but I'm telling you, this guy, within 6 weeks, I have seen every single patient we work with, we see improvement. And getting that pelvis and that spine oriented, and then we can work with your husband as well to get this chest, pelvis, rib cage, all that arranged with the tongue. I'm not even huge on doing much with your tongue at this stage. That will be more like a secondary, because right now I want to make sure that, we will get you to myofunctional therapy, that's for sure. But I want to make sure that we hit the right spot first and get that tongue at the proper time addressed. So let me just, before we get to the end of this call, I'm going to do a few things. I'm going to just see how your jaw moves and how your tongue moves. So I need you to first put your fingers right by your ears, like here. Okay. Okay. So I want you to come a little closer to the camera. Excellent. So, all right, Meg, I want you to slowly open about this much. There we go. And close. And do it one more time. Okay. Now, when you do that, do you hear any noises in either jaw?
No.
Okay. Now I want to make sure you locate your finger right behind your condyles. Okay. Now open all the way for me slowly. Okay. So you deviate for sure to the left. So that's a given. Like I said, I have no doubt your mandible wants to be on the left. You're a left torsion. My question is, why is your neck not to the opposite side? You know what I'm saying? That's a $1 million question I need to get answered. I mean, I hope I'm right in this ortho problem, because if a dentist caused it, a dentist can fix it, right? So when you did open all the way, did you hear any noises in either jaw? Which one?
My right side.
Got it. That's perfectly. So you deviate to the right. Now I want you to open really wide for me, like that, and see if you can put 3 fingers in there between your incisal edges. Okay, so you never had limited opening. You don't have limited opening. Now I want you to open really wide for me. And I want you to get the tip of your tongue and stick it right behind the two front teeth, like this. Right behind them, right at the roof of your mouth. So do it one more time, open really wide first, and then go ahead and put your tongue right behind. There you go. You see, you close about halfway to get your tongue up. That means you have a restricted tongue. I want you to stick your tongue out all the way like this. And curls down. And I want you to stick your tongue to the right ear. And now to the left ear. So your jaw has to move for your tongue to move. Now, I'm going to have you put your tongue completely at the roof of your mouth, like this. And see if you can suction your tongue completely to the roof of your mouth. Like you want to make a tongue snap, but don't make a tongue snap. There you go. Can you open and you keep your tongue suctioned? You probably can open about a third of what you can open. So all of this test tells me you have a restricted tongue, which means your tongue never shaped to form the arch. And right now it has a low tongue posture, and the low tongue posture goes like the whole host of things you said. It's a tongue issue. Do I want to address the tongue posture now? That's the goal, to get your tongue completely rest at the roof of your mouth. You may or may not need to get some of that fascia released. We'll decide if that's needed. But I'm going to do a couple of things on your nose and see how you breathe, okay? So I want you to close your mouth and take a deep breath through your nose. Deep breath. And blow through your nose. Okay, do it one more time. You're using a lot of chest and your neck to breathe. And now I want you to plug one nostril like this with one finger. Good. Now take a deep breath now. And out. Okay, now I want you to block the other nostril and do the same thing. And out. Which one was easier to breathe?
My left side was easier to breathe. My right side was more clogged, or at least it felt like.
Maybe it could be a nasal cycle as well. Now I want you to go ahead and get your fingers right behind, besides your nostrils, and pull on both sides. Good. Now take a deep breath. Does that feel better?
Mm-hmm.
Okay. So we have a restriction, and that goes along. Like I said, the cranium distortion, we already saw it in your mouth, we saw it in your jaw, we saw it in your ears. That passage is not it's narrow, but also twisted. One side is smaller than the other. That goes all the way to your pelvis and your tongue and your toes and the way you walk. So which one do we address first? Let's get you first in. I want to examine your skull and your head and neck. Then I'm going to have Dr. Craig examine your pelvis and your spine, because untwisting that is the most important. And the only thing I would suggest to do is using one of my cheapest devices, the most inexpensive ones, to just separate your teeth and support your neck to the place where it needs to be, and then work on your tongue. And taping your mouth. I don't know if you've heard about it, but taping your mouth so that your tongue gets out of your airway with the proper amount of support, the proper amount of space, can we get your tongue out? Before we do that though, every patient I meet, before I get off the call with them, I haven't done anything if I don't show them how to breathe through their nose and how to actually practice some nasal hygiene. So I'm going to go ahead and drop in the chat box here my website. If you can go there, I have some recommended product. Where's the chat box, Liliana? There we go. Perfect. So ARC.com. Okay. So let's go ahead and go there right now. I'm gonna make sure that it. 1 second. Can you open that link?
Mm-hmm.
Okay. So I'm going to go ahead and share with you. There's a couple of recommendations I have here. It's easier for me to just send you here, and everything I recommend is here.
Sure.
I want you to try 2 of my nasal devices I recommend to everybody. One of them is the Mute. Have you ever heard of any of these devices? Have you seen them?
No.
Okay, so you could order all of these right straight from Amazon. You can buy this one, only this 2 you can buy in Walgreens, Walmart, even you get Sprouts. So the Mute, it basically is adjustable to the side of your nose that's a smaller, and it literally goes inside your nose right there, and it will give you a little bit more tug. Okay, this is the first thing I want you to try, and if this is not something you can tolerate or it doesn't quite work for you, then we can go ahead and try this other one called Intake, which is like a more of a Band-Aid, and with a couple of magnets you can plug in, then it just literally open your nose. I don't like the breathe right strips because they don't hold up, and is not as effective. This one, my patients have had some good reports with it, but this is a very inexpensive startup. Between small and medium, you can just get the trial package and see which one you're more comfortable with, and it stays put because you don't want it to come out at night. This is the first line that I would like all patients to use. By the way, you can reuse this up to 2 weeks. Even during the day, if you feel like this was amazing, you can use it during the day. For like, just like I did here. Oh my gosh, I can get air in my body. Okay.
Right.
And then once you get used to it, you can start using this tape. And that's my recommendation for tape, because it's very hypoallergenic. And I love this one. My kids love it too. And just put that vertically over your mouth at night to see if you can tolerate it. Okay. This is all you attempt to get your tongue up. And this spray, just to exercise some nasal, like blow your nose or use your neti pot if you use any, and use that spray just to reduce some of that inflammation, to get that passage cleared up. Because if you haven't been nasal breathing ever properly, you probably have a lot of inflammation. This helps with that without drying you up. There's no medicine in it. It's hyperosmotic with xylitol base, which is all natural. And these are some of the products I recommend. But if again, you have sinusitis issues, this has been a miracle worker for a lot of my patients that can't tolerate the neti pot. Again, these are all my nasal protocol devices. You start with the most inexpensive, this too, and add the tape. And if you really want to get fancy, get this one. Again, you can buy it on Amazon. These are recommendations. So far we have homework to do. Liliana's been on the call, and she's gonna she has your email and will communicate with you, getting you in. She'll get the records. I will need to have about a week to just review them. I'll be in Spain next week. I'll try my best to look at it while I'm away. And then when I come back, we can have Dr. Craig see you. If you contact his office, I believe they have just one opening that they might be able to offer you on the 23rd. That's the day I'm flying out. If you could take that appointment, if you can make that work, because otherwise he's through end of May, early June, the sooner the better. I'm still going to get you started with the unilateral system. That's not a problem, but I'd rather him see you as well and then have a course of action. Lydia can help you with giving you the contact number, or if you're on my website, go to the recommended professionals, and Bella is on there too, and Dr. Craig's office. You can just call them, send them an email, get an appointment. You just tell them I send you, they know exactly what they need to do. And then we find out after I see your CT, what is the course of to permanently address it, to address the oral structure, architect your mouth and your neck and your tongue, and what it takes, and all that 9 yards. So I'm gonna stop here, let you ask any questions, anything you need clarifications, anything still might be gray. You have the recording to go back and look at. Let me know. What are your questions, thoughts, Meg?
I mean, it all is, I mean, it makes what you presented makes perfect sense. And I think I've been hoping for something just to, explain why all of this could just, I know it's all connected, but this makes much more sense in my head now. Because, I was confused as to what it meant just to have like an obstructed airway or trouble breathing, and I was literally wondering why I'm so lopsided on my whole body. And I always wondered why my posture was bad, and how I could never, no matter how hard I tried, I could never never had the effort to fix it. So I'm excited that this makes sense. And this is bringing me a lot of hope that I have not had in a long time.
I'll send you a couple of videos, Meg, that you can watch with your husband. I think being a physical therapist, you can relate to it. Unfortunately, a lot of people think they can work on their posture, and I explain in those videos that posture is a manifestation of breathing. And if you can't breathe because your body is twisted, your structures are twisted, you will shift your body to get the breath, because brain is not concerned with the stability of your joints and longevity and thriving. Your brain is only geared for survival. And if you can't breathe and respire and get the lymphatics drain and the oxygenated blood back to the heart, you will do whatever. You will turn into a pretzel to make sure you can breathe, because it doesn't matter what's for lunch if I can't get the next breath. Yes, and I love it when I have doctors like Dr. Danny who are like, yeah, there's the autonomic nervous system on, and their hormones out of balance, and thyroids and cortisol. Might have something to do with the breathing, and the fact that they recognize it. So makes me overjoyed because I got nowhere trying to get the medical system, MDs that I worked with at the ENTs to see that, because as far as the ENTs are concerned, mouth breathing is not a problem. It's just another way of breathing. They don't believe taping should be a thing, that we're all just a bunch of quacks. So that's for another day. I'm just glad when God is sending me patients, it's like, okay, I can't fix the system, but one patient at a time, we could totally, right? Because
That's
once I get you all healthy, and by the way, once your nervous system gets back to function, ask Liliana, she is the patient, right? She was told that she will not be able to, like getting pregnant and all. She has a beautiful baby. You can see the picture. And she could tell you that headaches, had to wear glasses every day, and TMJ problems and all of that. And now she's on the hunch to just get people healthy, because there's not enough people to know about it. So if you see student of yours, you see them like they're having these problems, behavioral issues, and you look at their faces like I did, just tell their parents to come and just show them the videos that I prepared, send them to my website. Because if we can get these kids back on track,
right.
we have a whole nother generation. And I'm telling you, stuck in them under the inside indoors, lack of being under the sunshine, lack of breathing properly, and all toxicity, and it's all combination. This next generation needs a lot of help. So every time I get someone that's in contact with younger people, I always leave them with this, like, I'm putting this in your bucket, just pass on and just pay it forward. Somebody else, you can save somebody else's life.
Right.
Okay.
Definitely.
We will be in touch. Liliana is a great resource for you. Lily would be following up with an email, and we will hopefully see you this week. If not, let's keep the appointment on the 26th. I will get cards and we do that. All right, Liliana, you have any questions?
Okay. Yeah, so I can shoot you a text here. I can see you either at 3 or 4 o'clock this Wednesday at the Institute.
I can 4 o'clock would be best.
Okay, yeah, I could do 4. Just because I know you're teaching and it's out late, so I could do 4 o'clock if that works for you this Wednesday.
That would be awesome.
Okay.
And
Yep.
get her teeth scanned as well, just in case I want to
Okay.
order for Vida. We can coordinate that.
Okay, I'll still shoot you a text so I can send you the address,
Perfect.
and then we will see you this Wednesday at 4 then.
Okay, awesome. Thank you both
Awesome.
so
You're
much.
so welcome.
All
Megan,
right.
I will send you, I will upload this to my private YouTube channel. It would not be visible to public. It's just that you can share with everybody you want to, but obviously you have it on your computer as well. But have your husband watch it and share my
Definitely.
findings with Dr. Dan. If he has any question, we can definitely communicate with your permission.
Perfect. Awesome. Thank you so much.
You're welcome. Have a lovely day.
You too. Bye.
Bye.
Anna.
Okay, bye.